Anyway, Dr Geoffrey Wells is a urologist in Victoria, and he's the one who put together the letter with some of his colleagues. He's going to tell us how that came about, protesting about the lockdowns in Victoria. Welcome exclusively to Outsiders, Dr Geoffrey Wells. How are you, mate?
I'm well, Rowan. Hello to you, hello to Rita, hello to James. And first of all, thanks very much for giving me and the 500 doctors who have signed this letter the opportunity to put our views across on your program.
Well, take it away. Tell us what those views are, Geoffrey.
Well, basically, we're talking amongst our colleagues, and we've been quite concerned about the government's response to the management of the COVID pandemic. And so we've written an open letter to Daniel Andrews. Now, unfortunately, at this stage, we haven't received a reply, Rowan, but we're still hoping that we might get a reply at some stage. And basically, the take-home message we want to put across to the community is that the lockdown, we believe, is causing more harm than good. And that's it in a nutshell.
Well, Dr Wells, you're a very highly qualified urologist. The chief medical officers would disagree with you. They think the lockdown is doing a great deal of good in saving lives. What would you say to them? And may I just ask, how qualified are these bureaucrats to overrule the opinions of the medical profession in many cases?
Yes, well, that's a good question, Rowan. We have a chief medical officer who's a cardiologist, a Dr Wilson. I don't really know a lot about him. We have the chief health officer, who's Dr Brett Sutton. Now, I'm sure he's a lovely fellow. He was a A&E registrar for quite a number of years, and he's now gone into public health. He started off as Dr Sutton, and he's now been promoted to Professor Sutton, so he's an adjunct professor. And then we've got a couple of other people who are in the firing line, and then they're giving information to Jenny McCarkis, who's speaking to Daniel Andrews.
So now, are they listening to... So you're concerned that it's doing more harm than good. Spell out what that harm is and why are they ignoring this harm that is being done by the lockdown?
Well, first of all, what we're seeing is that the number of referrals from general practitioners to specialists is markedly decreased. It's probably down about 70%, Rowan. And what's happening is patients are then coming to see specialists at a later date. They're, might be 3 or 4 months deferred behind. And as a result, if patients have cancer, then the disease has progressed. So there are studies coming out of the UK, and it's been published in The Lancet, where they believe that there can be an increased death rate of about 4,000 people from the UK because of delay in medical people coming to see the specialists.
Rita.
So...
I was just going to ask specifically about the aged care sector. What's happening in those nursing homes, and can we protect the most vulnerable in the community without absolutely destroying the livelihoods and, in some cases, the lives of everyone else?
That's a good question, Rita. So that's exactly right. What we want is a two-pronged approach. Now, people in nursing homes, absolutely, they're vulnerable. They need to be looked after. We need to care for them, treat them with respect. But we know that looking at the statistics on this virus, if you're in a nursing home and you're over 80 years of age and you've got significant comorbidities, then the chance of dying is markedly increased. It might be up to 25, 30%. If you compare this with people in the general community, if you're under 65 years of age, then the chance of dying from the virus is markedly decreased. It's about 1 in 150,000.
Jesus.
Wow.
So we're not.
James,
so it's a big difference. So what we're not. We don't want to. Sorry, James. It's just we don't want to trivialise the effect of the virus. The virus is causing harm. We know this, but there's a big divide between those patients who are elderly with comorbidities in nursing homes and patients in the general community.
Just very quickly, James, we've got to go in a sec. James?
Yeah, I just want to ask both what your plans are next and what are you and the 500 doctors doing next, and how do you guys react when the police assistant commissioner says that people who question all of this are, in his words, batshit crazy?
Yes, well, we don't consider ourselves batshit crazy, James. We're highly respected professionals. There's 500 of us. I mean, a lot of people have got 30 or 40 years of experience, and we're compassionate, and we want to get a message across that there's a lot of fear in the community. We're very upset about this. There's social disharmony. There's the anxiety in the community is starting to boil over. And then we've got the business community. And I've got patients that are coming in and they've been in business and they're really, really hurting. So what's our plan? Well, first of all, we want the lockdown to cease. And as I said, two-pronged approach. Following this, we're very keen for nursing home care to be under total scrutiny. Now, we want some accurate figures from the nursing homes. We want to see what's going on with the virus. We want to understand testing. We also want to make sure that there's a two-way street so that people can speak to the bureaucrats. So basically, what we want from this letter is we want to open the door. You see, as we know, if you stifle political debate, bad things can happen. And we feel as though political debate has been stifled. I've got patients that are in the business community and they've come up to me and said, Geoffrey, it's all one way. We haven't got an input.
Yeah,
and
absolutely.
Fortunately now, I think we're getting an input, Rowan. I think the tide, Rowan, is turning.
Good. I'm glad to hear that.
The message is that we want to have this message that the lockdown is causing more harm than good. Look, the disease might come back. We don't think it will. The epidemiologists are now saying the transmission in the community is very low, but the disease could come back. But we can't just keep locking down the community.
Absolutely. We've got to leave it there. Sorry, Dr. Wells. We've got to leave it there and go to our break. But absolutely, the message is the lockdown is bad news and the doctors of Victoria want it to finish. Thank you so much, Dr. Geoffrey Wells.